Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina Carew, and Dr. Dominique Vanier. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements. Hello, everyone. Today's Gut Girls episode, we want to talk about food sensitivities and bloating, specifically IgG food sensitivity reactions. So what do these mean? How are we testing for them? And what are the guidelines recommending for their use for our patients? So when you think about bloating, it makes sense to think about the food that you've recently eaten that day. If by 4 p.m. you feel like you want to race home and rip off those jeans, or you're starting to see a pattern with the foods that you ate, and 30 minutes or even 2 hours after, you're bloating, you'll want to avoid that food because that's not the best feeling. It's also pretty common, and I don't know about you, Christina and Dominique, to patients for saying, my friend did this food sensitivity test and removed the foods and now feels so much better. Or they're seeing people talk about this on social media. And it sounds great. There's like a root cause problem. There's great tests that will just outline the exact plan that you need to do. And that will cure your bloating, your brain fog, the loose stools, and these other weird symptoms that I'm having. You guys find this a lot in your practice as well?
Yeah, actually, I have a friend who her birthday cake, there was a birthday cake in her office, and there was a note, it was like gluten-free, egg-free, all these frees. And I was like, are you anaphylactic? And she was like, oh no, I did a food sensitivity test 15 years ago, and those came up, and I've never eaten them since.
Oh,
And we had a whole discussion, and she eats eggs now.
yay.
Yay! It is so common to see people who've done this test like a long time ago and then they're still following it, right? And I don't think that's really the intention of the test and certainly not the intention of the practitioner, I think, doing it. Like there should always be a conversation about reintroduction. But then there's also like the whole fears behind that part too. Like the test itself is like this one thing that you can do to then give you all this insight, right? Which I think it kind of simplifies really somebody's digestion.
Yeah, and that's exactly what we want to talk about, is how this is likely an oversimplification. Our bodies are fascinating and complex, and there's often a lot of things going on. So we want to talk about this immune response. That's what food sensitivity, or this IgG, is. It's an immune response. So we want to talk to you about this. Christina brought up anaphylaxis, so why you would want to avoid foods forever. So we'll kind of differentiate those two pieces. And before we dive in, I'll introduce who's here. So I'm Dr. Whitney Baxter, and I'm joined with Dr. Christina Carew and Dr. Dominique Vanier. And welcome to the Gut Girls podcast. Okay, so we're going to dive in and talk about the myth, are food sensitivities causing my bloating? So specifically IgG food sensitivity. Let's explain the difference between IgG versus IgE, and we'll give you some context into what these mean. Christina, do you want to explain the difference between the two?
Sure. So when we think about our immune system, there's all these different responses that can happen. So there's IgG and IgM and IgE and IgA response. So there are all these different activations. The way I often explain it to people is like around messaging. So the first messenger, that person that kind of looks out the door and sees what's going on, is called the IgM. And that isn't a very specific reaction. It just tells us like, hey, something's going on. It sends some information back to the body. An IgG reaction is a secondary reaction. And so that information was taken and more specific immune system response goes out. And so in the case of these food sensitivity tests, the body's like, hey, I saw some peanut. I'm going to send a response back to the body. Or, hey, I saw some strawberry, or maybe there is mustard over there. And so that kind of sent a response back to the body. It's seeing something that is in a place where it shouldn't necessarily be. And so these immune system actions happening inside your intestinal tract, they're kind of happening outside your intestinal tract. And so it's immune response to the item that was seen. It doesn't necessarily mean anaphylactic reaction. It just means it was seen in a place that we don't expect it to be. And so the difference between that and going to an allergist, IgE type tests, those scratch tests you may have had an experience with or heard about, that test doesn't say, is this out of place? That says, if I have an exposure to this, will I get a swelling rash? Could the potential for my airway to be blocked? Is that sort of the reaction I can have? And so these are the people in your labs who have EpiPens who are sensitive to fish or to peanuts or to dogs that may have to use that to prevent their immune system from going into overdrive.
Yeah, awesome. So there's just two different types of immune response: immediate emergent, IgE, versus the delayed, hey, I found this thing, IgG response. And these immune responses are handy for bacteria and viruses that are dangerous and our body needs to protect ourselves again. And sometimes these foods are an inappropriate response, but IgG still have to avoid it. It's going to send you to the emerge if you don't. Whereas IgG, it's showing up in different ways. So this is what we'll dive into. And then another thing we want to talk about too is just the definition of a food intolerance, because this is where the guidelines and the research is pretty accurate. And it does make sense to do kind of elimination diet or a discussion around this if you are getting a lot of bloating or other digestion type symptoms. So a food intolerance is not an immune response. It's more of a malabsorption. So when you eat, your digestive enzymes are incompletely breaking down and absorbing this food. So it's getting to your gut as a larger molecular component, and your microbiome is having a bit of a party. So it's fermenting, it's eating this food and causing gas in the process. So this can really cause symptoms of like excess gas. Fermentation is gas production. In some cases, there's an osmotic pull of water into the colon. So people are getting symptoms. So these are typically to the carbohydrate components of food. So like fructose, lactose, obviously lactose intolerance. You've heard this term before. Other things like sucrose, fructans, and then you've heard of the FODMAPs. So this is different than an IgG food sensitivity response. So we just wanted to bring that up. Okay, so back to the food sensitivities. In the bloating world, they're often described as, okay, so leaky gut is happening where the gut lining should be kind of a closed off compartment so it can selectively bring things into the bloodstream. However, for some reason, there's more gaps and things are leaking through, triggering an immune response. And this IgG-mediated delayed onset of symptoms like bloating, brain fog, digestion changes, etc. The solution: do a food sensitivity test. We'll draw your blood, test for these IgG complexes. We'll eliminate all those foods so you don't get those symptoms. We'll heal that leaky gut, and then we will slowly reintroduce the foods. So this is what I was taught in school a lot, and this is what I hear about a lot. And a lot of people come into my practice asking for these types of tests. I used to do them, and then I'll talk about later why I've since stopped. But we want to talk about, are these tests accurate? Are they picking up what the patient is experiencing? Is it truly that food leading to the bloating? Do we have to eat like this forever, which we talked about earlier? So if we look at the data, there was recently a 2026 review of IgG elimination diets for IBS. I couldn't find anything specifically for bloating, but it did talk about some bloating in these people. So there are 13 studies involving 900 patients with IBS. So they were following the Rome 4 criteria. So overall, they did IgG-based elimination diets, and they did find that in general, they improved symptoms, including abdominal pain, bloating, so expansion, distension, bowel habits, stool consistency, and subjective rating of quality of life. So some studies noted other improvements in anxiety, migraines, fatigue. However, there were substantial differences in the study designs, how they were, what the control groups looked like. Sometimes the two groups were, okay, this group is going to remove the food sensitivities that came up on their test, and the other group is going to remove the things that didn't come up on their test versus other types of controls. Additionally, and this is talked about in every single study that I look at for IgG, there were concerns raised regarding the risk associated with excluding multiple foods, which may lead to altered eating habits, increasing malnutrition risk, which is huge. If we can't always guarantee that these tests are going to work or be accurate, is it safe and best practice to be recommending them with the risk of causing fear? So yes, they may improve IBS symptoms, but there's a lot of limitations in the studies and how they're designed. So let's talk about this. Let's break this down a little bit. I want to go back to this concept of leaky gut. And Christina, do you think this is oversimplified? What's a more realistic way to describe this? Or how do you talk to your patients about this?
Yeah. So the reason that the food sensitivity test might be showing positive is because there's these escape valves that Whitney sort of alluded to, where these, like, I was thinking about them as pinholes. So the way I describe it to patients is to imagine like a brick house. And so a brick house has the cement in between the bricks that stop the outside from coming to the inside. And your body, in between their cells, and the intestinal tract also has zonulin, which is the glue in between the cells. And so when something irritates the cell and causes it to be inflamed, then the glue in between gets dislodged, and that's what creates these tiny pinholes. It could be a food. So it could be something like celiac disease, where the body has inflammation, but it could also be an infection. It could be something in their environment. So we see that commonly with people that have mold toxicity, environmental exposures. There was a study that was released yesterday that talked about people with diabetes type 1, that this is a very common symptom that they have. We certainly can see it with food sensitivities, but it's not only from food sensitivities. And so when I think about a food sensitivity test, we're really just measuring one thing that has potentially escaped or created this inflammation in the system. And we're sort of disregarding everything else. It's the same reason why we started this podcast. We came up with more than 20 reasons why people have bloating. And each week we're going to talk about, what are those different things to consider. It isn't just like one test equals one solution for every person.
Yeah, exactly. And I think that's where it gets exciting, is the body is so complex. And that's where we need to find individualized approaches in medicine, as opposed to doing these very specific tests to find the root cause. We need to look at the person and kind of evaluate it from that perspective. But yeah, okay. So thank you. That makes a lot of sense. And then, are these food sensitivity tests accurate? So I've read about studies where they draw the blood from the same person and they send it off to 2 different labs, and they've tested it and it comes up with different results. That makes me feel uncomfortable if I'm recommending a test that can cost up to $400 for somebody. So Dominique, can you talk a little bit about the accuracy of these tests?
Yeah. If you take a step back, like when you do a test, there's something called specificity and sensitivity, right? Which is like, basically that just refers to like, is this a true positive? So if a test result comes back positive, is it actually a true positive? Could it be a false positive, right? Or is it a true negative when a test result comes back negative? So you want, like when you're doing a medical test, it needs to have that degree, like that high degree of accuracy, we'll call it,
like high sensitivity, high specificity. Not to get into like further kind of nitty-gritty details there, because we can talk a lot about that. But when I did a deep dive in the literature for IgG testing, we actually didn't have there was no data that I could find on the specific diagnostic type of like method that was used for IgG testing. So that's called the ELISA method, or the enzyme-linked immunosorbent assay. So we actually don't even have like information on it in that way. So when it comes to the reproducibility of a test, so for example, doing your IgG test one day and then doing it again the week later, I don't have an answer for that. And so when, you're recommending a test for somebody and then also expecting them to take out large food groups from their diet based on the test where they may actually have different results if they had done it the week later, I wouldn't actually call that good medicine. And I'm going to be very like straightforward there. So I personally did used to recommend this test, and for, various reasons, when I looked into it a little bit further, including how robust the research was behind this type of testing method, I felt less and less confident using it with patients for a number of reasons.
Yeah. Yeah, we care about our patients, and we really love when we can find clear evidence for things. And
Did you ever have a test where something weird showed up?
like a random food?
Yeah, many
Yeah.
times.
I had a patient came in from a different practitioner, and the only two things on the test were jalapenos and lettuce as the two primary foods that they were reactive to. And so I was like, "Oh, do you love a tacos?" I've never eaten a jalapeno ever before in my life. I was like,
And I think like when it comes to a test, it's also important to evaluate, is there a different method that can be used that's like less invasive, less costly, that would get us to the same outcome, right? Like the same outcome, which is like reduction of bloating, identification of foods. And we'll talk more about that, but there are.
Yeah. Yeah, there for sure are. Yeah. And I've read articles where they're like, okay, these IgG complexes were found in healthy people where they're not noting symptoms. So do they just exist in the bloodstream as our immune system? Hey, I found this. Are they then leading on to immune response or inflammatory symptoms or triggering all these things? And at what point are we thinking more, is this a disorder of gut-brain interaction, which we'll get into in other episodes, but is this pertinent person's sensitivity to things heightened? So it just brings up a lot of questions. So if we think about what our guidelines are recommending, so what is the gastroenterology guidelines recommending? What are the allergy associations recommending? So from European, Canadian, and American, they all maintain strong positions against the clinical use of these food-specific IgG testing in diagnosing food allergies or intolerances. So it's pretty clear in all of the major guidelines that we follow. They emphasize that these antibodies most likely represent a physiological consequence of oral tolerance. So basically saying that the immune system just said, hey, they're there. It's not a causative factor of disease or bloating. So we like to follow the guidelines. It makes us feel more confident, especially because as naturopathic doctors, we're working often with patients' medical doctor, and they've maybe seen an allergist and they've received some allergy testing. So we like to all be on the same page. And then the studies aren't great, which I talked about before. There's limitations. There's different study methods, non-standardized IgG cutoff thresholds, lack of placebo control, small sample sizes, which doesn't improve confidence. So if we go back to this idea of like pain and bloating and like the physiology behind it, what's happening? Christina and Dom, I'm curious, do you see this in your practice from other things? Like, could other things be triggering these symptoms, like mast cells, histamine, other immune responses?
yeah, you can still have a response from food that creates bloating, but it may not be from 35 different foods that may show up in the test. It might be that you haven't been checked for celiac disease. So it's a very common reason why someone could get bloated. Or you are having a food reaction. There's an episode coming up that talks about mast cell activation. Mast cell activation is about 30 minutes after eating, you're going to get a series of symptoms, some of which could be gut depending on the person. which may include bloating, which starts to make you think, actually talked to someone earlier today about that there's a food that they're reacting to because it's causing all these gastro symptoms, when the actual issue is that eating is causing the reaction. And so it's just a body that feels like it's on fire or inflamed. And so it's not as simple as remove strawberries and things get better.
100%. Yeah, like this kind of like didactic approach. It's really not do this input and then therefore this output will happen. Definitely. At least I haven't seen it that straightforward. Sometimes it's that straightforward if somebody has a very basic like lactose intolerance, right? But truly, like, yes, celiac, there are many conditions that we can see bloating in, right? And like when we talk about that visceral hypersensitivity piece, like part of that is where somebody who has this hypersensitivity, they're going to feel their digestive processes so much more acutely than somebody else who, let's say, doesn't have a disorder of gut-brain interaction. But there's also like that pain disinhibition that happens with the visceral hypersensitivity. So like we're getting these signals from our gut, like that's sensing like bloating and speaking about like, discomfort and then pain. And then the brain through the central nervous system is not dampening those signals like the way it should. So we can see like this bloat, this non-specific bloating really sprinkle through so many different digestive conditions.
And in other conditions, we see it post-COVID. There's lots of people that are getting more leaky gut or hypersensitivity because their immune system's just been like overwhelmed. We see it in mold, we see it in Lyme disease. So it's not that you necessarily have those things because you have bloating. It's just that bloating can be caused by so many different things.
And that brings up a good point. Is there ever a time where you're recommending reduction of foods for those types of things? If they have a super leaky gut, are you reducing the inflammatory foods, I guess, like wheat, gluten, dairy? Do you ever talk about that in patients?
I don't know what you guys do, but I often will do like a 30-day gut reset with my patients where I will take out some of those foods, but it's a very long time and it's a very strategic reintroduction. So it's not forever. It's to kind of make the process happen faster because we're not also, I was trying to get rid of the mice having mouse traps and then leaving your food on the counter. Like you can't get rid of both things at the same time as easily, right? And so if we could reduce leaving the food on the counter and just direct everything towards the mouse traps, we can just get further ahead faster. So instead of a patient being on treatment for 3 months, maybe they can be on a treatment for 30 days. So there are some strategic reasons why we might reduce foods or take out certain foods.
Yeah. And that's such a good point, like that clear timeline. Because that's so freeing to have, okay, we can do this for 4 weeks. We're going to reduce the fire in your system. And then this is the plan. Because there is immune reactions happening, especially in individuals who have these post-viral things or mold or MCAS, mast cell activation syndrome. So it's helpful to reduce that input, but for a short period of time as you're working on the immune and gut healing and all those good things.
Well, even some of the research on the low-FODMAP diet, which is like the most common diet, right? And that does involve some elimination with a very structured reintroduction schedule, is when it can like basically calm the system. We'll call it calm the system, which we can see changes even in like the visceral hypersensitivity aspect too. So from like a scientific standpoint, like there is rationale behind trying to approach it from a food angle in addition to other angles, because like we said, there's multiple things happening. Yeah, it can be very helpful. I've seen it very helpful for patients. Yeah, with again like a plan with a plan.
Yeah,
and I would say if you are going to test for celiac disease, even though it's going to be a whole nother episode, please make sure that you are not stopping your week before taking the test, because more often than not, we see people that have a negative test and think they're clear, but we actually don't. Because you have it similar to these food sensitivity tests, the foods that can show up are only the foods that you're currently consuming. And as part of that is a piece of the puzzle, is like, you can't measure something we don't have any exposure to.
Yeah, that's a good point. And that brings up the point of systematically approaching someone's bloating. So when we meet our patients, we're hearing their symptoms, and there are some things we need to rule out, like celiac disease. We'll talk about that test, how to do it properly. What other symptoms are going on? We need to do some blood work. And then in between that blood work coming back in our next appointment, we want to make you feel better. So we're going to do a low-FODMAP, or what has the best research for outcomes. Usually it's a low-FODMAP. So we'll talk about that with our patients too. Okay, thanks guys. That was awesome. Let's talk about some practical takeaways from this episode. So first of all, we do want to look at bloating and how there are so many causes, and it's not just food. And the guidelines actually don't recommend cutting out foods as the first step. So we want to systematically work through your bloating. Unless it's pretty obvious and there is a clear connection, we can start to talk about that. And definitely rule out celiac disease and true allergies. And then also discovering your unique food tolerance or intolerances. It takes time. So there's often a systematic elimination period. We're going to work together frequently through this, so you're not on your own. There's going to be a clear plan with recipes. We just are truly not wanting to cause fear around food or making you think that you have to do this long term. It can take time to figure out your unique intolerance or what's triggering your system. And food elimination may cause more harm than good. If it's not introduced this way, there could be nutrient gaps, nutrient deficiencies, or restricting your lifestyle. We don't want to make you afraid to just go out with your friends or have to eat outside of the home. But the guidelines are great. The studies aren't great for these food sensitivity IgG tests, and all the guidelines recommend against them. So that's just something to keep in mind. And anything else to add to this piece, Blake?
I think before we forget, we should also include the hair testing for foods in this. I don't know if you guys have seen, they have ads often on some of the social media platforms.
I've seen it more for like mineral testing. I don't know about food sensitivity, so do go on.
I had a patient come in with the test was $25, and she snipped off some of her hair and sent it away, and they came back, and the number one thing that she was sensitive to was duck blood. And so we had a good laugh about it. But just like sometimes the responses when they come back help to understand like why that test is ineffective, but we also can see the exact opposite happen. So I had a patient who was already on a very restrictive diet. Her son was on a restrictive diet, and they did the test, and all of the items were eating the items that came up because of sort of the idea of leaky gut and the things that were sort of exposed to them. It wasn't that they were sensitive to all those 60 foods. It was like really scary because this child, 6-7 years old, and his mom was controlling his diet. And now we're at a point where like they already were missing the foods out of their diet. And so there's more. And so just keep in mind, as much as that tells us they're amazing things, they may be not anything for you.
Right. My little one agrees with that. Honorary baby here agrees with that. I think to your question, Whitney, it's the investigation part with a skilled practitioner is super important because yes, like on one hand, we want to be ruling out, are there more kind of structural things going on, right? Was a colonoscopy performed, like celiac testing done accurately, et cetera, et cetera. And then figuring out, okay, well, if we've ruled out kind of more serious issues is like, where does that leave us? And can we even hone down a little bit further as to what's happening? And for a lot of patients, there's like multiple things happening that's causing the bloating. But then matching, what's like the best available treatment is to that, rather than just, I'm going to take out these foods and just hope for the best.
Yeah. Yeah. And the longer something takes, the more sustainable it usually is. If you're doing a quick test with quick results and it's giving you a tiny plan, that's all you've got, right? And as opposed to having a really comprehensive assessment, testing, discussion, And then like you've got this toolbox and you understand your body so much more. Isn't that more valuable than, one size fits all approach? So we always like to leave our listeners with some ways of talking to your practitioners. So instead of, I would like to do a food sensitivity test, you could bring up, hey, I am feeling this sensation. I'm feeling bloated. Describe that feeling to your practitioner. Let them know when it happens, if it happens right after eating, how long after eating, is there pain, is there any association with stools or nausea? So just get really clear on what you're feeling. And then you can even go on to ask, could this be a food? Could this be a food intolerance? Could I have an allergy? Or could I have visceral hypersensitivity? You could get really scientific with it. But just be more curious and with your own gut and your digestion too. All right, everybody. Yep. Thank you so much for listening. That's all we got for today.
Thank you for joining Team Gut Girls. Like, follow, subscribe, and share a podcast with friends you think will want to know more about their gut. You can also visit us at teamgutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.